many of my new moms want to know when they can return to running. And although it is a complicated answer because everybody is different, here are some general guidelines that you can apply today. 1, how far were you running before you got pregnant? It's important to know what your level of fitness was before you got pregnant, as well as how much running you were able to continue doing during pregnancy. This is very variable from person to person and from pregnancy to pregnancy. So it's important to realize what your body has gone through in the past 10 months in order to determine when it's safe to get back to running. Number 2 would be the general rule of thumb in that you are pregnant for 10 months. It's going to take 10 months for your body to fully recover. Now, you don't necessarily need to wait until you're fully recovered, but it is something to think about that you probably won't be back to the mileage you were before pregnancy, at least until 10 months out, and maybe longer. Another good rule of thumb that I like to discuss with my moms is you want to have lost about half of the weight that you gained during pregnancy. You see that excess weight, which is obviously all in your belly, causes increased force through your abdominal cavity. And if you don't think you activate your abdominals very much while you're running, I guarantee you, running after pregnancy will show you just how much you need them. And number 4, speaking of those abdominals, you want to make sure that there's no diastasis recti. That's when the abdominals have separated and there's that space in between. And you want to make sure that your C-section scar has fully healed and is moving well. You can do that by gently placing your fingers on your C-section scar and then trying to move the skin over the tissue underneath. Does it move pretty easily, or does it feel like there's some sticky spots? And number 5, the all-important pelvic floor. We want to make sure that there's no bulging, no leaking, and no pain. Please, if you're suffering with any signs of pelvic floor dysfunction after pregnancy, do not try any high-level activity like running until you've seen a pelvic floor specialist. And number 6, you want to make sure that you're not suffering with any hip pain or abnormal for you hip tightness. Some people get hip tightness if they haven't been running a lot. So this would be hip tightness that is new to you since delivery. That hip tightness, if it's new to you since delivery, can be a sign of a pelvic floor dysfunction. And again, you would want to seek help from a pelvic floor specialist before returning to any high-level activity. And know that I am here cheering for you and hope that you have a safe return to running after pregnancy.